Hello everyone, welcome to RAAONLINE. I'm Dr. Abhinaya. I'm a consultant pediatrician. So in Nelson-based pediatric teaching, the next topic of discussion is on muscular dystrophies. So I have decided to divide the muscular dystrophies into two presentations because it is quite a lengthy topic. And part 1 was about DMD and BMD, Duchenne's and Becker's. So this is part 2 of muscular dystrophies where we are going to discuss only about 3 muscular dystrophies, so myotonic congenital muscular dystrophies and limb girdle, LGMD. Okay, so this is a short presentation where we are going to only see the salient points, and of course as residents, as pediatricians, we see a lot of Duchenne's muscular dystrophy. LGMD or myotonic dystrophy is quite rare, but it is also common, and the age presentation is quite different from the DMD, so we tend to miss out. And these patients are constantly they're roaming around, and they usually go to the orthopedicians, neurologists before they come to a pediatrician. To clinch a diagnosis, we have to know the basics of these muscular dystrophies also, isn't it? So we will go through quickly. So the first one is myotonic muscular dystrophy. So this is actually the second most common muscular dystrophy after DMD and BMD. We should never miss myotonic muscular dystrophy because, like Duchenne's, this is also a multisystemic disorder. And it just not involves the striated muscle, that is, it just not involves the striated muscle, but it can involve smooth muscle, it can involve cardiac muscle, it can have cardiomyopathies, smooth muscle involvement can be there, so the gastroparesis. So it is a multi-systemic involvement. Not only that, it can involve immunological issues, and it can lead to malignancies. So very, very important to diagnose myotonic muscular dystrophy. And the incidence is around 1 in 20,000 to 1 in 1 lakh. This is a global prevalence which is different from different parts of the world. And all the types of muscles are involved: striated, smooth and cardiac muscle. Very importantly, endocrinopathies, not just one endocrinopathy, but 3 to 4 endocrinopathies are associated with myotonic muscular dystrophy, which I will be discussing in a moment. Next is immunological deficiencies. These children are known to have hypogammaglobulinemia, that is pan-hypogammaglobulinemia, or at least decreased IgG levels. So that's important, and they have an increased risk of malignancy. So diagnose these patients, keep them under a close follow-up, work along with a pediatric neurologist and an orthopedician for their care. They can have cataracts. By now, I assume that you all know what type of cataract is present in these children because we have learnt this right in our third year MBBS, isn't it? So in ophthalmology, have you all learnt about Christmas tree cataract? Yes, Christmas tree cataract is seen in myotonic muscular dystrophy. It is a posterior subcapsular cataract. So when these patients have come to your attention, refer them to an ophthalmologist, look at the eye, complete ophthalmic evaluation, and keep them under ophthalmology follow-up also. So look at these boys. Facies, typical facies. This is a typical myotonic muscular dystrophy facies. So this is of course a facies, like usually in a myopathic facies, what we say, it is an expressionless face. There can be some amount of ptosis. There is a temporalis wasting. There is a masseter wasting. And typical is this open mouth appearance. Tinted upper lip will be present, and a slack face. Some amount of wasting in the neck muscles will also have like a pencil neck appearance. So this is a typical facies of a myotonic muscular dystrophy. Intellectual abnormalities can be present, slurring of speech can be present. So what is this myotonic muscular dystrophy? What is myotonia? So I will tell you how to demonstrate myotonia in the next slide. Before that, there are 2 types. Actually, there are 3 types of myotonic muscular dystrophy: type 1, type 2 and type 3. Type 3 we are not going to see as pediatricians. It is a late form which usually presents in the 3rd decade. Type 1 and type 2 is the one which we see. Clinically, they appear similar, and very, very little differences between type 1 and type 2, which is, I'm not going to go so much in detail. But when you suspect myotonic muscular dystrophy, you have done a myotonia, you have done a handshake, you think that it is myotonic muscular dystrophy. When you ask for the genetic study, when you write, you have to ask for the repeats. Type 1, we know that it is caused by CTG repeats, right? CTG repeats, which is present on the DMPK gene. Type 2 is caused by CCTG repeats. So this is the difference between type 1 and type 2 muscular myotonic muscular dystrophy. So this is DM1, that is myotonic muscular dystrophy type 1, is present in the culprit gene is present in the DMPK gene. Myotonic muscular dystrophy type to the culprit gene is CNBP. So this will cause CCTG repeats. This is triple repeat nucleotide sequence, whereas here it is CCTG repeat.